The adult preventive care package involves making sure, again, that all patients know what the appropriate screening tests and information education are for them in their age group, and for us as providers to make sure that we more easily and more completely are caring for our patients and making sure that they get all these things done. Adult preventive care has a lot of people that are involved with it. It very heavily involves our assistive staff, so our MAs, our RNs, our schedulers, and we did that specifically because we wanted to change the workflow that had happened previously with adult preventive care. Much of it relied on the provider only, and we felt that a lot of this could be streamlined so that the provider could spend more time with the patient, explaining things, addressing other issues. So a lot of our workflow has moved to schedulers and MAs doing work ahead of time with pre-visit calling. So they're contacting patients before their appointment to let them know what's coming up, to get some of the information that they normally would have gotten at the time that the patient arrives in the clinic. This way, a lot of that upfront work is done before they reach the door and reach the exam room, thus allowing more time for the provider and the patient to spend together, whereas a lot of that time was taken up in the past. With the adult preventive care package, we felt that pre-visit planning and pre-visit calling was going to be very important. One of the things that we wanted to do is streamline that office visit so that the provider actually has more time with the patient to partially to explain some of the things that we're going to be doing and that we'd like them to do, give them more information, and be able to discuss concerns that the patient has. In the past, I think the provider has really spent a lot of time doing some of this arranging and scheduling and making referrals during the office visit, and then we had less time to actually talk to the patient. What the pre-visit calling and planning does is takes that all out of the actual office visit time and does it a few days in advance. We're able to give out referrals to things like mammograms and colonoscopies, and in the best case scenario, patients actually have those done by the time they reach us at the office visit, whereas in the past it could have taken lots of time afterwards. That's still the case in many instances, but they have the opportunity to do that ahead of time, and it gives us a second opportunity to reinforce that those things are important. They also get a chance to schedule lab appointments, so they may have their lab results available for us to discuss at their visit. A lot of the questioning that we normally would have done when the patient reached the office on the day of their appointment is actually done ahead of time. So much of that time that, again, would be taken at the office visit is done ahead, so the actual rooming process is much quicker, and then we, again, have more time with the patient. Some of the initial things with the adult preventive care package are going to be delineating those new roles. I think that's really important so that everybody understands what their piece in this is. So a lot of spending time with the different members of your staff to make sure that they're all very comfortable with what they'll be doing. And it's also for the providers. They're going to need that as well, because some of this, again, is shifted away from them, and we need to learn again, as providers, to do things just a little bit differently. So anytime you're learning something new, I think it's going to take the time to spend on the education piece. That's probably the baseline. There's an entire package of tools that each clinic and individual providers can use as reference, either when they're starting this package newly in their clinic, or if they need reference along the way, if they have questions. Providers have quick and easy ways to get to the background clinical guidelines to give them more information as they provide care for their patients. And again, for the workflows, all that information is there as well. The tools that we have built in Epic for the adult preventive care package are really important. They're the guideline from the pre-visit call all the way through the end of the visit to make sure that all the elements are taken care of. One, that all the questions are asked that we think are important. Two, that all of the recommended screenings and counseling messages have been addressed for that patient, because that's our ultimate goal, is to make sure that our patients are getting all of those services that are recommended by evidence-based guidelines. CMI in general, that concept of the team approach to patient care that we have implemented in our clinic. So we have different stations in our clinic where several medical assistants or LPNs are working with a group of doctors, and we don't have the one-on-one nurse-provider relationship that has been the tradition in the past in medicine. That's kind of a basic in CMI that really has been part of, I think, what makes this work. So we do feel that that's an important piece to have in place before starting to do this. I don't think that clinics would not be able to do the adult preventive care package without it, but I think it would be more difficult. It's much more efficient this way. It sets the stage then for the pre-visit planning and pre-visit calling. That way there's the team of MAs or other staff that are helping to do these pre-visit calls. And since they aren't tied to a particular provider, one MA can be making calls for the day. Another MA can be rooming patients that are there for visits on that day. Other people can be doing other jobs. So it allows for this process to happen without the stress of one MA and one provider, and that MA having to room the patients, do all the things that the provider needs, as well as calling their pre-visit calls. As it turned out, we have very few instances, but we do have some, where patients do feel a little bit uncomfortable on the phone talking about this type of thing. And we have had patients turn down the pre-visit call. They're very few and far between. And we have no problem with that. We say, of course, that's understandable. We'll do the same, the rest of this information at the visit. We try to educate our patients. We have built-in scripting for the MAs when they call patients to help them feel a little bit more comfortable about what's about to happen over the phone and to help them understand why we're doing it. And we try to tell them that and make them feel comfortable that this really is here to make your experience better. Hopefully it's going to give you more time to talk with your physician once you get into the room with them, and more time to address your concerns, and a lot of this sort of busy work type stuff with setting up referrals and lab visits and things like that will be taken care of, and it'll be less that you have to do at the time of the visit. So I think it has worked out better than we originally anticipated. Anytime there's something new thrown at us as providers, it can look a little bit daunting. Even being approached with this project and myself being the one to influence how it happens, it was still daunting. So it's understandable. I think if that provider is open to hearing a slightly new twist on how to do adult preventive care and is willing to give it a try, and they have the support of the clinic who's ready to do the CMI and to put it all into place, I think that they should feel comfortable that that this is a process that can be very helpful.